Hello, my name's Paul Robertson. I'm the curator of the Museum of Healthcare at Kingston. I have the honor today of speaking with Dr. Ralph Crawford, a Canadian dentist who, along with his wife Olga, have for the past 40 years been amassing an absolutely fantastic collection of Canadian dental history. They've been avid collectors and curators of this collection for that period of time. And this collection was originally, or came to be, owned by the Dentistry Canada Museum in Ottawa, part of the Canadian Dental Association. That collection has now been made available to the Museum of Healthcare, and we are honored to be able to give it a home and to add it to our growing collection of healthcare artifacts in the country. I welcome you, Dr. Crawford, and I thank you for spending a bit of time with me today.
Well, thank you for having me.
I'd like to ask you a few questions about how the collection came to be and just what your background was that led you to collecting, or your interest in dental history and how this collection came to be. What inspired you to begin collecting?
Well, I really didn't become a dentist until I was about 37, 38 years of age. I had had 3 careers before that. But having been married, well, just a couple of weeks ago, 58 years, my dear wife Olga and I have always had an interest in things old. And we visited antique shops and went to auction sales. And if you came to our home, I would show you our collection of Canadian cut glass and Irish Belique, this sort of a thing. They're just collectors. Once into dentistry and into dental practice, we kind of started then to collect dental items that we saw at various sales or antique shows and this sort of a thing. But I think basically at heart we're collectors, and we homed in on dentistry when we opened a practice.
Where did you find these things? You mentioned your early days of collecting in antique shops and places like that, but I imagine that the collection has come from a variety of different sources.
Yes, once we started to collect them, and we became the dental organization in Winnipeg, where I practiced all my life. It's a close-knit society. We all know one another. And once my confreres found that we were interested and we collected some of these things, you know, it kind of became known, Pack Rat Crawford, and where previously they had thrown the things out on the landfill, they would give us a call and they would say, Ralph, I've got this old, what do you call it, would you be interested? And of course we were. So it kind of spread through the community.
Do you have a favorite artifact?
They're all favorites of mine, but yes, there are some that are more favored than others. We're particularly proud of our collection of ivory dentures. The ivory dentures that are over 200 years old and carved out of solid walrus and elephant tusk. How they were created and how people even wore them was a mystery to us, still a mystery. But one of the fascinating things are these ivory dentures that someone very ingeniously on the anterior front teeth, instead of having ivory, they embedded and riveted human teeth.
Wow.
To the front for cosmetics. And our modern dentists may think that they are the inventors of cosmetic dentistry. Hey, not at all. I can show them exhibits that are 150 years old that were there just for good looks. That is a favorite of ours. I like to talk about that. The other is what I call a finger ring drill. And this goes back to 1846. And it was a drill that went around your finger like this, and you turned it by hand.
Wow.
And to this day, I take it and try and drill something, and I'm having great difficulty with it. And I figured that it does about 75 revolutions per minute, where the modern high-speed drill is 250,000 revolutions
wow.
per minute. So those are a couple of the real favorites that I like to show off to people.
Now there's, I think the most famous smile, if I call it that, in the collection belonged to a Canadian Prime Minister.
Oh yes. One of the items, artifacts that came to us really about 8 or 10 years ago was a set of dental impressions, casts of John Diefenbaker. And it actually came from a dentist here in Kingston.
Wow.
And it was sent to our museum, and we had these dental, we had them set up on what we call an articulator, and there's John Diefenbaker's teeth smiling at us.
I know the collection includes certainly some more modern pieces and the innovation in sports dentistry. Can you describe some of those pieces a little bit?
Yes, the development of the mouth guard and the helmet is really a Canadian contribution. And a great deal of it had to do with Dr. Arthur Wood and an ophthalmologist by the name of Pashby, Dr. Pashby, who saw accidents in hockey in the Greater Toronto area, and they collaborated together to develop first the mouth guard. And the first mouth guards was developed by a dentist, and this was, I would think the 1950s, and it went from there. And then the face mask and the helmet, and dentistry was really at the beginning, the forefront of this contribution to the decrease in facial and dental injuries from all sports. And I can well remember early in my own dental practice in the 1960s how we introduced mouth guards for the first time to dental communities, to sporting communities, and it was quite an innovation.
Was there resistance at the beginning?
A little bit. The hockey players to wear these things, and they were more cumbersome than they were now. They were quite awkward. Yes, there was a resistance, but particularly with the community clubs where they were working with children and young adults, we made an agreement that we would make the mouth guards free of charge if they brought forth a mandate that you couldn't play without one.
Ah, okay.
And so that was kind of the deal that we made, and it worked.
Now, did you have particular goals with the collection? I mean, certainly as it moved out of your office and into the Dentistry Canada Fund Museum, and it became more public, did you see not so much a mandate perhaps, but goals that you hoped that this collection would achieve from a public point of view?
And our goal is, just as we somewhat discussed, is to afford an opportunity. We were very proud of the progress of our own profession and proud of the contribution that dentistry makes to people's health. And we wanted the dentist to acquire that same kind of pride and same kind of knowledge. And so the goal was to set up the exhibit so that it was of interest to the public, to the profession itself, to give them a sense of where we were and where we are and hopefully where we want to go. And maybe the whole not the whole object, but maybe someday we won't even need dentists if everyone has perfect oral health, you know.
In conclusion, I'd just like to ask you one question. In thinking about the collection as a whole, what you and Olga have achieved over the last many years, what would you say is the main message, if you could describe it that way, with the collection and its scope and its content? What would be the main message that you'd like Canadians to know?
And I've already somewhat alluded to it, is this is where we came from. This is what dentists were trying to achieve, to bring optimum oral health to the patients to whom they're dedicated. Mm-hmm. And the struggle, in many instances, the struggle to develop this, to have gone from here to here over a period of time where the objective is to treat patients in the best possible, least intrusive method in order to bring them a satisfaction of overall health mm-hmm. and comfort, so that they can chew better, so that they can smile and look better and feel better about themselves. And this is what health professions are all about. Our physicians, our nurses, whatever health profession, is to bring better health and well-being to the patients. So the objective of the museum is to tell that story. We were here, we struggled, mm-hmm. we innovated, we developed, we arrived at this instance because those other people have made this contribution.
I thank you very much, Dr. Crawford. It's been a real honor speaking with you today and learning more about how the collection came together. And we at the Museum of Healthcare look forward to having the opportunity over the next many years to build on what you've got, to interpret it for the people of Canada, and to be able to tell the stories that you have collected. Thank you very much.
Our pleasure, because just to have the artifacts and the story exhibited to everybody is just overwhelming from us, and thank you.
We hope to do it justice.
Thank you.
Thank you.